Good morning. Happy Monday, everybody. Today I'm going to discuss fevers, which has been a hot topic lately. That I did not mean to put a pun there, but I did. I just thought about it. It's kind of funny. So this has been a popular topic, I should say, and I've talked about it in the past probably, but I figured I would just do another video on it again so you don't have to search through. So fevers are the body's normal response to any type of infection you have going on. So don't panic if your kid has a fever. Even if it's 103, we don't need to panic right away, okay? So that's always the most important thing, okay? It is our body's way of fighting infection, even simple colds, okay? If you talk to your doctor, there are other things that we look at when it comes to fevers. So age of your child is a very important factor. Are we dealing with a newborn or a 1-month-old or a 6-month-old or a 5-year-old, 11-year-old? We will manage the fever in those age groups differently, and we will ask specific questions about some other clinical symptoms that are going on, if there's any vomiting or pain or things like that, to help guide you through the process and decide, okay, do we need to see your child right away, or can we kind of sit on this a few days and then decide if we need to see them in the office and at what point in time. In regards to taking your child's temperature, the best way to do this, and I know people are uncomfortable with this, but a rectal temperature, even up to kids who are 3 years of age, is the most accurate. You have to remember, kids and babies have very large heads. So that's a lot of their body's surface area is right there. So when they get a fever and they're really hot, where do they lose their heat from first? Their head, right? So they are, when you do that temporal artery one, the thermometer, or the ear temperature check, those often, they're just not super accurate in kids and really anybody. They're not my favorite way to check a temperature at all. They can be falsely elevated. They're very user dependent, and we see a lot of error with it, so it's not my favorite. So my favorite way to check temperatures, rectal's number one, which it's super easy to do. Talk to your pediatrician. They can show you how to do it. An oral temperature for kids over 4, and even an axillary, just under the armpit, is an alternative route too, which is helpful to do because we're trying to get that core body temperature is what we're really wanting. I don't want just the heat temperature that's radiating off of your child's head. Another very, very important thing with the fever, actually look at your child or your baby or whoever, because some kids are acting fine with a fever of 102. It's kind of wild, I know. They might not be bouncing off the walls, but they might be just sitting there watching a movie. They're able to drink fluids and they're okay. Other people might be absolutely miserable with a temperature of 100. So you have to treat based off of how your child actually looks and how they are feeling. So you don't have to give Tylenol or ibuprofen every time your kid has a fever. You want to give that if they are literally miserable. So the goal is get that temperature down to a point where they're able to drink fluids and they're not feeling so miserable. If they're not feeling that bad and they're drinking fluids, let that child's fever just sit there. It's okay. It's not dangerous to have a little bit of an elevated body temperature for that time period because, again, it's doing what it's supposed to do. It's fighting off some kind of infection, okay? So other tips, if you're concerned about that temperature and how to get it down, like I said, Tylenol, ibuprofen are great. A cold wash rag, on the neck, the head, armpits, groin area. Those are other ways to cool the body down. A lukewarm bath is also another helpful tip too. Okay, guys, if you have any questions or comments, you can leave them below. Remember, if you have any specific questions about your child, make sure you contact your pediatrician. Bye, guys. Have a great week.